All right, picking up for part 2, risk-taking evaluation for hazmat incidents. This is chapter 14, part 2. Risk a lot to save a lot. That whole risk a life to save a life mantra, we've kind of beat risk management to death earlier in this class. Definitely doesn't play into effect here. We want to make sure that we are taking calculated risk. There is very little margin of error when we're talking about hazmat incidents. We will not risk a life to save one that is already gone, even though some of these situations, especially in industry, have certainly proven to be challenging as we faced would-be rescuer situations kind of in the tech rescue world and even in the hazmat world. So some of the risk issues that are at play for hazmat is obviously going to be liability. We don't have to play so much along those lines. We are on the hook for our actions, obviously. We will not be absolved from that. But the liability for cleanup, the liability for some of the outcomes after that scene is passed over to other agencies, we're not necessarily responsible for some of those outcomes. As far as risk communication, what that boils down to is there's an IAP, a written IAP specifically in these situations, written safety plans, and all of that has to be communicated. What level of risk are we taking? Maybe even a justification of why, and then we move forward with the team from that. Communication from risk, communication from tactics, strategies, all of that is very, very important on these incidents. This kind of speaks for itself. Technicians must follow a prescribed approach. What does that mean? Slow, methodical, and intellectual. We are going to slow down for these incidents. They take time. It takes time to gather intel. We're not just going to blaze into a chlorine vapor cloud thinking that we can do it like smoke from a structure fire. We're going to slow down and we're going to take our time, specifically from the mitigation standpoint. As far as accountability systems goes, there could be 2, maybe more in place. We may expand on this a little bit, but hazmat team members, hazmat responders that are operating in those control zones certainly have to have their accountability system, and there may be a separate one for the support, those that are in the cold zone. And this is typically going to be in the larger incidents, but there may be a separate accountability system for those supporting agencies and those that are operating outside of those control zones. Should they be intertwined? Should there be accountability for both sides at all times? Absolutely. Incident safety officers and their ASOs, if they need it, need to be accountable for both of those groups. Control zones, we've talked about it already. Hot zone, we need the escape route for the hot zone if things go awry. If there is an evacuation from that hot zone, you need to have a safe refuge area when you're contaminated before you can decon and come back into those other zones. Decon corridor, that's all going to take place in the warm zone. Decon ideally will always take place in the warm zone before anybody comes back into the cold zone of these scenes. Zone getaways, that can be taken into context. You want to have an escape route on these scenes in case there is a wind shift or some type of other environmental shift, if you will. You want to have an escape route from any of those zones and even the command post should something drastic happen. This is a little layout map of an ideal setup. We're not going to spend a whole lot of time talking about that, other than each scene is going to be different, folks. Make sure that you're paying close attention to where these things are set up with respect to upwind, uphill, all the normal hazmat considerations that you would take even back from our initial training at the awareness and ops level from rookie schools. All that stuff still applies. Communications, the importance of that goes without saying. You need to stay in touch with those that are working in those hazard zones, have a backup system. Depending on the scene layout, that could be as simple as hand signals or verbal. Any type of communication equipment that we use in a hot zone that might be remotely flammable, obviously we want that to be intrinsically safe, meaning that it's not going to create a spark. Rehab, medical monitoring becomes important there, especially depending on the level of PPE And then those other two with sanitation and food service, that's going to be some very, very long, drawn out incidents. Those are those situations that could be multiple operational periods, and you may even be looking at the potential for an incident management team at that point. We discussed earlier the importance of having that ASO, and we talked about why. The importance of them being trained, obviously, is the whole reason that they are brought on as an ASO. We talked about the regulatory requirement for that, so we're not going to beat that to death. Anybody who comes to help, anybody who decides they want to play, we want to brief them on the hazards that are associated with these incidents. The list that you're seeing right there, that personal documentation assistant, that could be something as simple as a scribe, public health representatives and risk managers. Once again, we're dipping into some of these far more large scale incidents than we would expect the initial responders that we usually operate in the capacity of. Public health representative could be if a hospital or a school or something like that is affected, you're going to have multiple agencies and, the interest of public health more than anything. Documentation. There are 2 slides on this, 3 slides rather, and there are lists here of what is required. Site control measures. Hazmat is going to be one of the few areas where a written safety plan is required. You may even see that on a test. Hazmat incidents, especially ones that go multiple operational periods, have lots of documentation required, and a site safety plan is one of those. So the ISO, whether he or she has the assistant safety officer conduct this or they do it themselves, that site safety plan has to be completed. And all of the list, anything that you can imagine that happens on the scene has to be addressed on that site safety plan. What is it? What's the hazard associated with it? And how do we mitigate it? So the control zones and locations, the decon procedures, emergency plans for if something goes awry at the scene, confined space, if it's applicable. We will talk more about that in the rescue chapter. I'm trying to keep these lectures as short as I can and applicable. And any containment needs to be documented also, but the list go on. IAP, the comms plan, exposure protection plan, evacuation plan. Obviously, this is one of those situations where this is more so a list of things that the ISO might have to sign off on, not necessarily be tasked with creating at this point. We may even get to IMT level action with some of this stuff. This is going to be a very large size incident, but the ISO may have to sign off on some of these plans because they have a safety element to them. When you get in the world of clandestine drug labs, meth labs, and other rogue drugs or chemicals, it's going to be a multi-agency response, as you can see here. Fire, police, EMS, public health, EPA may get involved. Depending on who it affects, you may see social services, and that kind of stems from the law enforcement side. If people are displaced or if there are underage children involved, it could get pretty far reaching depending on the situation. But obviously, in those first few minutes of the incident, we want to focus on our people and the hazards that they might be faced with. This could migrate to a unified command, such as some of those large incidents that we talked about earlier. But fire, police, and EMS is where our bread and butter is going to be, and just know that there will be a multi-agency response effort from that. Some of these other agencies may have an incident safety officer or somebody that operates in the safety capacity. They may not. So who you would have accountability for and authority over essentially stems from the incident commander at that time, and that can get kind of confusing if they spin up a unified command. So we would just kind of have to take that in stride. Just know that your role as the ISO, you have responsibility for the safety of all responders and members of the public. Just keep that in the back of your mind as some of these incidents unfold. Hazards related to the clandestine drug labs. I'm sure at some point in our careers you've run one or have seen something similar to one. So what creates those hazards? Poorly ventilated area. Sometimes it could be a dumpster, sometimes it could be a bedroom. Flammable and toxic atmospheres. Those incompatible chemicals are actually probably what created the hazard in the first place. Some of those chemicals could still be reacting, so keep that in mind. Obviously, that's going to be done. You'll discover that in your recon phase. You'll discover that whenever you determine the level of PPE that's needed or assist somebody in determining the level of PPE that's needed for this. And some of this stuff may be in Coke bottles. Some of this stuff may be in coffee cans. It could be in a solid container. All of this traces back to, is the container, what's the integrity of the container for these chemicals? It just references some of the things we talked about before. Booby traps, we used to see that a lot, not so much anymore, but keep in mind that the people that are running these labs are likely fearful or anticipating law enforcement arrival. So we want to have our people high situational awareness, head on a swivel type thing, make sure that we're not walking into any booby traps or weapons or weapon systems or something like that. And that may spill more on the law enforcement side to clear that area before any hazmat teams start to take action on this. On the weapons of mass destruction side, depending on how large the incident becomes, obviously going to be a multi-agency response very, very quickly. There's a presidential directive that references the FBI taking over on these larger calls. Your initial incident safety officer, which is what we would be operating in the capacity of here, initial ISO, you may be turning all of your safety work and even your safety authority over to the safety officer on an IMT, depending on what kind of response you get from the feds or even local law enforcement agencies. The ISO, you need to keep that strategic level of thinking, keep the big picture in mind. If you need ASOs to go out at the task and tactical level, you obviously have the authority to do that. Just keep that in mind, though. You need to stay at that strategic level of thinking, that command level of thinking. The quick in and quick out approach for immediate rescues here kind of applies to all hazmat situations. If you can do a quick in, quick out rescue and you can do it protected, obviously that's what we're here for. We're here to serve the public. We're here to save lives. And then the damaged property or the damaged environment comes next. So I will encourage you to revisit some of the risk thinking, risk benefit analysis that we talked about earlier in the course, and use that as a foundation for your decision on whether or not it's a go or no go for a rescue. But it does fall back on incident commander discretion, ISO input and discretion also once you get some information on the situation. That wraps up chapter 14. If you want to read the summary, obviously you certainly can. But that wraps up the material for this chapter.